Examination of the bone marrow smears. So the first thing is to examine all the stent slides with naked eye and choose one which has enough marrow particles or fragments and is spread properly and stand evenly and best. In some disease particles, these particles are tend to clot during preparation, like in multiple myelomas, autoimmune disorder, or evenly in megaloblastic anemia. These particles tends to clot. And while in cold heme agglutinin disease, RBC agglutinate if the slides and syringe were not warm. So it's compulsory while dealing with the RBC heme agglutination disease. The slides and syringe are pre-warmly required, and a good smear has a reddish blue color. Then this is a normal hemogram of the bone marrow. These are the normal values. Like in normally the myelobblast count is 0 to 3%, promyelocyte are 1 to 5%, myelocyte or 6 to 17%. Metamyelocyte normally found in the bone marrow is 3 to 20%. Band neutrophil normally are present 9 to 32%, where segmented neutrophil are 7 to 30%. Similarly, eosinophil and eosinophil precursor are 0 to 3%. Basophil and mast cells are 0 to 1%. Megakaryocytes are 2 to 10 visible per low power field. And on the other hand, when we are dealing with erythropoiesis, so pronormoblast are 0 to 1%, basophilic normoblast are 1 to 2%, polychromatophilic are 10 to 20%, ortho are 6 to 10%, and lymphocytes 5 to 18%, where plasma cells are 0 to 1%. Monocytes are 0 to 1%, macrophages like histocytes are 0 to 1%, and ME ratio. So ME ratio, if you are looking here, so myeloid are 0 to 3% and pronormoblast are 1%. So it's become 3 to 1 of the ratio. Myeloblasts are more than erythropoietic cells. So 1.5 ratio 1 to 3.3 ratio 1. This is a normal values of all the cells which are present in the bone marrow. Now examine under the microscopy, and it's the most important thing. First, examine the selected slides under low power, that is 10x objective of the microscope, and note the following thing, like note for cellularity, for megakaryocytes, other cell like osteoblast or macrophages, abnormal cell like LD bodies, etc. Erythropoiesis, myelopoiesis, if we are looking for parasites, so examine for the presence of parasite, particularly Plasmodium falciparum. Then we have myelogram, and we'll discuss it one by one, that what is myelogram and what are the importance of these cells. And then we are looking for ME ratio, and finally we are looking for the blasts. The first thing is cellularity, and this is noted for both the fragments and trial. These are the fragments are bone marrow particles, and what are trials? So trial is the part of smear left behind by fragments during spreading. So these trails also have important cells, and they are neglectable, like you cannot neglect them. And now, what are you looking for basically under the cellularity? So normally one third to half of a fragment of bone marrow from an adult contain hematopoietic cells, which is the rest of its comprises fat species. And if the proportion of hematopoietic tissue is less than this, then the marrow is termed as hypocellular, and if it is more than marrow, is termed as hypercellular. Sometimes fragments are only composed of thick mass. This is sometimes called packed marrow. So, like here, this is a normal marrow, and these are the fat species. These are the myeloid cells. Here you are also looking for some megakaryocytes, but here in the cellularity, you are specifically looking for hypercellularity, hypercellularity, packed marrow, and then you are also looking for the trail. Here, this is a normal cellularity of a bone marrow. This is hypercellular, and here you are looking for hypocellular. Fat spaces are more here. Then the other one is megakaryocytes, and both the number and maturation stage are to be noted here. Normally 2 to 6 megakaryocytes per low power field are present, and these contain a nucleus with 6 to 10 lobes. Or these are also called segments, but normally we call it loops. Megakaryocytes tends to collect toward the trail and may form masses if the marrow has clotted before preparation of smear. At this stage, some normal and abnormal large cells may also be seen, like osteoblast, macrophages, mast cells, and endothelial cells, and they are normally seen in small number, but their number may be increased in certain disease state. Osteoclast should not be confused with the megakaryocytes. These are much larger, having granular cytoplasm with distinct ruffled border, and contain several discrete rounded nuclei, where osteoblast should not be confused with plasma cells. These are oval, have a compact nucleus, and cytoplasm stands bluer, has no granular, and has a fried border. This is a plasma cell, where this is osteoblast. And when you are looking osteoclast, so you will not confused with megakaryocyte. Megakaryocyte has its own morphological feature, where osteoclast should not be confused with it. So the fourth thing is abnormal cells, and examine for abnormal cells macrophages containing parasite LD bodies, histocytes. It might be with or without hemophagocytosis, and storage cell like Gaucher and Niemann pixels, and clumps of some malignant cells. So these are the abnormal cells, and they have also its own importance. But you are looking whenever you are looking at morphology of a bone marrow, so you will not miss these type of cells. Now, the important thing is the selection of area, and now select a well stained area and examine with dry high power, that is 40x, uh, and mounted slides are best viewed with this objective, where oil emergent, that is 100x objective, should only be used for differentiating fine detail of the cells if required. Whenever you are looking the cellularity, then you are looking for megakaryocyte, then you have look for osteoblast, macrophages, mast cells, endothelial cells. Looking toward these cells, and then you found some abnormal cells. Now the exact hematopoietic cells you are looking for, like erythropoiesis, myelopoiesis, and some parasites. Now you are doing myelogram. So let's start from here. This is erythropoiesis, and what you are looking for the erythropoiesis, note the quantity and quality of erythropoiesis, whether it is normal, reduced, or increased, and whether it is normoblastic or megaloblastic. And also look for dysplasia feature as well, like dysplasic feature, cytoplasmic bridging, nuclear lobulation, multinuclearity, and fragmentation, etc. etc. The other thing is myelopoiesis, and here you are also noting the quantity and quality of myelopoiesis. Particularly look for any change in maturation sequence, granularity of the cytoplasm, like it is hypogranular or it is hypergranular, excess of eosinophilic or basophilic cells. Like we have already discussed it, what is the normal value of eosinophil or basophil in the bone marrow, and presence of giant myelocytes and metamyelocytes. You are looking for the examining parasites, and examine for the presence of parasites, particularly Plasmodium falciparum. Like this is a bone marrow smear, and here you are looking that it's zoom. So this is Plasmodium falciparum, which tends to sequestrate in the bone marrow, and similarly you are looking for Leishmania donovani. So these are the parasites which are almost present in the bone marrow, and sometime we are dealing with other disease and we are missed some such type of parasite. This also has some importance in the bone marrow examination. Now, what is a myelogram? And you know about the DLC, that is differential leukocyte count. So, what is DLC? You are looking 100 cells under the microscope for a peripheral smear. And what is myelogram? So, now you are looking or you are performing differential count of all nucleated cells in the bone marrow. This should include all stages of the maturation of WBCs. However, all stages of erythroblast are counted collectively. At least 500 cells should be counted. It is preferable that differential count should be performed for more than one random selected area. uh, the differential count of bone marrow smear is called myelogram, and the differential count of peripheral smear is called DLC, that is differential leukocyte count. That is counted in 100 cells, where myelogram are counted in 500 cells. These are its normal values, as we have earlier discussed in the earlier slides. So like myeloblast 0 to 3%, promyelocyte 3 to 12%, and so on. So the other thing that you are looking for